Hello, everybody on Facebook Live. This is Dr. Peter Carter from Pediatric Partners, and here today to talk more about COVID and some updates that we have for you. We hope that this information is helpful to you. It is a time where some schools have started opening, and it's a time where some athletes are revving up their practices in different areas around the Kansas City metro, and a time when some people are not exercising because sports for schools and other private groups have been shut down. But it's a time where we're going to talk a little bit more about some of the new cardiology recommendations that have come out from the American College of Cardiology in the last month or so, to kind of help have you have an understanding of kind of what's going down and what's expected of families and of coaches and of sports folks that are running practices, and give you some advice with that. So we're going to talk a little bit about some of the sports recommendations today, and we're also going to talk a little bit just about some mental health stuff and making sure that we're all staying well in this crazy COVID time. Today is, I believe, Friday, the 28th of August. And so schools are starting in the KC metro area here for some, as I just mentioned, and some will be starting September 8th, September 9th. And so there's lots of stress and stuff going around as well with families, with kids, with adults, as we're all trying to sort out back to work and childcare and how are we going to do this virtual school stuff or partially virtual school on some days and try to figure out care for our kids on the other days. So it is a weird time in society. But today we're just going to give a few updates, and certainly keep reaching out to us via Facebook or via different ways, appointments if you need them, to talk further about your specific issues that may be going on in your family or your specific exposures to COVID. But we'll jump right in today with sports. It's a big topic across the world, and especially America and Kansas City. We're seeing lots of folks that just want to get back to sports. I saw on the news protests for, I think it was the Shawnee Mission District, and a bunch of parents and athletes in the Blue Valley District as well. I saw both school districts, actually. Some parents and athletes are just like, we want to play sports. It's good for our mental health. It's good for our bodies. It helps our immune systems, right? And all those things are correct. And so getting outside and being active is always going to be the goal. Certainly for the bigger kids, those team sports are a great way for that to happen. It's a great way for them to kind of feel part of a group and part of a team. So we will obviously continue to try to encourage activity the best that we can in the most safe and appropriate ways. Obviously the type of sport that they're playing or the amount of people that are congregating together will always help understand, what's the risk. And there's lots of good published, charts out there on Children's Mercy's website, on our website. Some of our Facebook posts have been about that. Obviously sports where you're congregated together inside in a small area, less safe as far as COVID risk than, say, an outdoor sport where you're nicely spaced out across a field and there's limited exposure or there's limited of those long exposures to each other. You might be in passing seeing someone and kind of breathing in their general area, but generally the duration of the exposure is pretty short. So keep that all in mind. Certainly there's sports that they're like swimming. It's kind of impossible to wear a mask, not impossible, but kind of discouraged to wear a mask when swimming. The World Health Organization and CDC have said, for most sports, wearing masks to some degree is a good idea. You may have seen some of the Royals baseball players and other people's wearing those little sleeves, almost like for ski trips, but they kind of pull them up and they're polyester and breathable. They may not be the best barrier protection, but there's some barrier protection because they're often thin and they might get wet and then they're not going to work quite as well. So that's something to be considerate of when you're kind of thinking about those things. But hey, it's a little bit of a barrier, so you're not breathing in somebody's germs as easily and you're not breathing them out should you be an asymptomatic carrier. So there's those kind of things to think about as far as when is this safe, not safe to have my child participate, or even yourself if you're doing like adult sports leagues or intramural leagues or whatever may be out there. So keep just kind of thinking about all that as you're choosing, hey, should my kid be doing this stuff or not? Certainly hand washing is going to be super important. If they're taking water breaks, separate out. I'm encouraging all my patients, my middle school and high school kids especially, who are able to think about it, and some of the upper elementary school kids, like, hey, if you're taking a break at practice, stand away from people. You don't have to be arm in arm or kind of geared up right next to the coach. And I feel a lot of youth sports leagues are doing a great job of kind of promoting this. We see some pictures on social media all the time of my own friends and just people in general anywhere, and it's not happening all the time by any means. And we just got to keep trying our best to kind of limit that risk. But washing hands and not rubbing your nose and rubbing your eyes when they're about to have a snack or something at break time, that can all be helpful. So, yeah, you got to find the risk reward for your family. And, each of you have a different scenario where, maybe there's an immunocompromised person in your house. Maybe you have a grandparent that helps you a lot and they're immunocompromised or older or have diabetes or heart disease or some other chronic illness that makes them a little bit more susceptible to this disease, COVID being an issue if it becomes something that a member of your family has. So just got to kind of think about all that. Luckily, the data still show that little kids are not getting as infected as often as the big folks and the adults over kind of the age of 16 to 18 are definitely higher risk than those that are younger than that. So we'll hope that continues. So just talking about some stuff as I look at my notes here, there are some recommendations from the American College of Cardiology that I wanted to kind of go over with you all today that kind of help guide us into this. A lot of the school districts have adopted a desire for anybody who's become COVID positive and as an athlete, they would like them evaluated by a medical provider. So we're going to try to be working with those teams and those kind of things in the school districts to try to help provide those services to make sure that we're clearing kids appropriately. One of the biggest issues that has come to play is that there have been some reports of myocarditis in folks with COVID, and what that means is a fancy word for inflammation of the heart tissue, and that can linger. It's not exactly clear how long that may last or what the clinical manifestations of that are going to be short-term and long-term. Certainly in the people that are very infected and get intubated or wind up in the ICU, it's found that those people obviously have a higher incidence of that myocarditis, but it can be something that can be a concern in just the average athlete as well. And so it's something we want to take seriously, and I'm going to kind of go through some guidelines now that will kind of help guide you back into play. So without symptoms, say somebody's COVID positive, they got tested because they were exposed or something like that. If there were no symptoms at all, or let's say even they got COVID and really just maybe had a fever for a day or two, no major respiratory problems, they weren't achy and full of pains and breathing troubles for weeks or even 5 to 10 days. Let's say that no symptoms, no real fever, and if they had a fever, it was less than 3 days. They felt pretty good, kind of like themselves. Like you hear about this in the news, sometimes people just don't have many symptoms. It's still recommended that they see a doctor after their 10 days from the start of symptoms has finished and they've been fever-free for at least, obviously, 24 hours at minimum, to have a doctor kind of give them clearance. And with the myocarditis concern, it is more important now that possibly that heart is evaluated. We can feel pulses in the clinic and listen to your heart with a stethoscope to make sure there's nothing going on that is concerning. But if all is well on the checkup, on the exam, and things are good, that patient would then be cleared for kind of participation back in sports. If there's more moderate symptoms, kind of the second category, and that may be somebody who required bed rest, somebody who had fever more than 3 days, somebody who had respiratory, kind of compromised to some degree, not necessarily hospitalized, but just kind of more moderate symptoms. They just felt kind of those people would need to be, of course, followed by the doctor of some sort, pediatrician or nurse practitioner or some sort of medical provider. If they're less than age 12, the exam for the American Cardiology is okay to give clearance. If the exam's normal, it's okay for the doctor to say, hey, I think things are good. Let's slowly get you back into sports, just because the incidence of that inflammation of the heart is lower in that group. And those kids often get less sick with COVID, as we all know, just kind of following the data. But if they're over age 12 and they had more moderate disease, it's recommended currently that those folks be seen by a provider, and then also the strong recommendation of considering an EKG, an electrocardiogram of the heart, which is where they put those little stickers on your chest. It's non-painful, and they just get a little, that kind of heart tracing to kind of look for any sort of changes to some of the amplitudes and different things on that EKG that might indicate that there are, some heart, some heart problems that may have occurred secondary to COVID. If those things are found, then it would be encouraged on a case-by-case basis, depending on what the severity of those findings were, to maybe follow up even with a pediatric cardiologist, somebody who's specifically trained with 3 additional years of fellowship and learning how to do this. And we are blessed with many, many great cardiologists right here in town in Kansas City that we can refer to help us kind of guide the next step and return to play protocols from there. So that's a possibility for those with moderate symptoms. And then the next category would be more severe cases of of the COVID. And that would be, hey, you got hospitalized. Of course, if you were intubated in the hospital, that'd be a big deal. If you had that multi-system inflammatory disease that has been in the news, that's kind of Kawasaki-like, that would be obviously considered more of a severe case. If you ever had an abnormal heart test, those kind of things are concerning. Again, that would be cardiology. That would most likely pediatric cardiology that would follow that up. And those folks, it's recommended for a good possible 3 to 6 months of kind of activity and sports restriction to kind of see what the heart is doing during that time. There might be some follow-up tests that might need to be done. And some of this is kind of coming, the protocols are coming into play as this is happening. So again, this is today's information, and it may be changing, as is always the case with COVID. But there might be future needs for just repeat EKGs, repeat echo, which is an ultrasound of the heart. Again, non-painful to the patient if it were to need to be done. There's the possibility of even heart tracing monitors called a Holter monitor that could be left on for 24 hours that the patient might wear for a day and would show the heart tracings in different activities. So those things are good and possible. We might even do a stress test where they would have a patient do exercise on a treadmill and kind of see what happened to certain functions and parameters of the heart. So those are just things to be aware of. There's certainly, so no symptoms, moderate symptoms, and severe symptoms kind of changes the protocol. There's some age group stuff. If you're just joining us, go back and listen to the last few minutes for some of those details about what the recommendations would be. We had a coach weigh in with a question, and it kind of goes like, how long do I watch my athletes for, and what do I watch for once they're cleared and they had COVID in the past? That's an excellent question. Again, it's a developing answer, right? So at the moment, we kind of say at least a solid 2 weeks of rest around COVID time is a good idea. And so once they've been cleared by the doctor, then kind of slowly progress back into those sports. And hopefully the physician will be given, or the medical provider will be giving a good detailed kind of, hey, let's work on this week and this next week, and kind of progress as tolerated. And then sometimes the more severe cases or the moderate cases, it might be even up to like 4 weeks where you're kind of a little bit more worried about getting them back into sports a little bit slowly. But the common things you would look for are things you're going to be looking for anyway, luckily, as far as, boy, this child's not tolerating the practice or the game as well as they should be. Dizziness, difficulty breathing, chest pain. Certainly if there's somebody passing out or having a syncopal episode, we want to know about that urgently. Decreased exercise tolerance. If they feel like their heart is just bounding out of their chest, or they just feel weird, those kind of things would need to be followed up. So kind of the routine stuff you look for anyway. It might kind of look like heat exhaustion, so we got to be careful just to make sure our athletes are hydrated kind of pre-exercise, during exercise, and post-exercise with tons of fluids, making sure they're getting enough electrolytes in their diet, occasionally needing the need for an electrolyte drink to kind of supplement, but we try to avoid a lot of those due to sugar intake that is added in a lot of those drinks. But just a good healthy diet is a good way to go. So those are kind of the things that we're kind of looking for. So anywhere from 2 to 4 weeks afterwards, kind of keep an eye on things. If somebody was severely ill, we're going to be watching pretty closely for even up to half of a year to kind of see what's going down with that. And obviously this is developing as we are gaining new knowledge and information from folks that are doing this, that are getting COVID and getting back into the more extreme high school or middle school kind of competitive sports leagues. So we will continue to update you as we know more. One thing I mentioned, we talked about face masks earlier. I forgot to mention that the World Health Organization and CDC kind of say for like extremely vigorous sports where there's lots of breathing in and out, they say that the masks aren't as essential necessarily, and maybe could be a little bit problematic, just as far as them tolerating breathing and running and playing. So again, the face coverings with sports is kind of always going to be encouraged, but of course if you're swimming, it becomes a little bit of a hassle and might get stuck, and you don't want to cause any troubles with breathing. But when in doubt, face masks, if it's just not tolerated, then just really work on the social distancing aspect of keeping you healthy and all those kind of good things. So that's kind of the latest sports updates. So basically a gradual return to play is going to be the play, and the districts, per some medical guidance, are requiring that a medical provider kind of look at all patients who have had COVID prior to returning and signing off on that. And that originally we were doing a little bit by telehealth, but with this new cardiology information coming out, most likely most practices will be doing an in-office visit where we can listen to your heart and feel pulses and kind of make sure that things are appropriate for you, and talk about the return to play protocol specifically for your child. So hopefully that answers some of those questions. Certainly if things come up, send a little message at the bottom of this post and we'll try to answer those in due time here and make sure that we get all those questions answered. And then as I alluded to at the beginning, so we're going to talk about the cardiology stuff that's changed a little bit, and then also just a little bit about just kind of mental health for all of us. In all of this, I've got one of our just random posters in our office here, talks about teamwork. When the best and brightest come together, the possibilities are endless. And I thought that was kind of just appropriate just to remind us that, hey, man, we got this. It is a challenging time. I know, at least in my family, we're feeling kind of tired and overwhelmed still sometimes by this COVID stuff and the constancy of it. But I just encourage all parents to just be open to, hey, man, these schools are working hard. We got to give them some trust that all the districts are trying to figure out the best play for everyone. And everybody has their own unique situation. It's not going to be perfect. It's not going to be perfect for any of us, but it's going to be. And, there's going to be another day. And so we just kind of, it's a great opportunity for us to kind of jump in and go with the flow a little bit and work on teaching our kids resiliency, work on teaching our kids about disappointment and kind of how to bounce back from all of that. So I encourage you just to kind of keep working on that, just like I am. And I know that a lot of people around my office are just trying to sort it out, use each other, talk to people. Boy, this is hard. What are you doing to make this work for your family? Have you found any tips with this homeschooling that's working, with virtual schooling? Hey, we decided to homeschool. I've had a handful of families that are just homeschooling and doing their own curriculums because they know that will be more consistent for their family. And reach out to others that are doing that. Just do it in community if you can, even if it's a social distance community. I think that's important. It's also important just to remember that there's health professionals out there that are around to talk to people, whether it be anxiety or just feeling overwhelmed or I don't know what to do because of this and this and this. I've seen some divorces happening during this time in families. And so if you're feeling stressed or overwhelmed, I just strongly encourage you to just do a gut check and go ask for some help and reach out to somebody. Those people are often PhD trained and if not master's level trained and just kind of coaching people through the stress of life. And so this is a time of life where there is going to be a little additional stress for everyone. And so I encourage you just to reach out to those folks and kind of look into opportunities for help. There's lots of good resources online as well. So kind of, play with our website. We've got a lot of good stuff in our mental health providers for kids and teens. Some free resource links and stuff like that, as well as just a list of great providers that we've had good feedback from our patients. So encourage you to do that and just kind of take care of yourselves, take care of your families, and look out for friends as well to make sure everybody is doing great with that. So that's the gist of today. Keep reaching out and keep trying to get outside and get exercise, as we alluded to at the beginning. That is a great way to release endorphins and help build your immune system and get a good diet with vitamin C and zinc and those kind of just natural immune boosters that we've known about for years. All that stuff's going to be important. Keep washing your hands. I wish you all a very happy and well start to this new school year, and I hope it goes really smoothly. I anticipate bumps, and I'm sure you are as well, but I anticipate that those bumps are going to be just part of our growing together as a community and as a people to just kind of keep being more resilient and keep just pushing on. So keep treating each other with kindness and respect. Remember the teamwork aspect in all this, not just in your sports today, but in just all aspects of life in your homes and in your social circles as well. So again, thanks for tuning in. We look forward to kind of doing these Facebook Lives still weekly for a little while as new information is coming out. And definitely, as you're watching these, just kind of look at the date to see when this speech or talk was given, so it's relevant for the time that you're watching. And then, we wish you well. Certainly, we are open for, give us calls or things if things come up, and we can have our nurses or our medical staff kind of provide advice for you on a more personal level if needed. But continue to use our social media and a lot of our posts on our Facebook site, which is our Facebook, and also our website, which is pediatricpartnerskc.com, to get the latest and greatest as those postings are put out there. So I hope you all are well. Have a wonderful, safe Labor Day weekend. And like all of you, I guess that's coming up soon. Like all of you, looking forward to getting the kids back in school. And I know that they're all looking forward to it as well, both the young kids and the bigger kids. So good luck to the college kids that are out there. Maybe you're tuning in as well if you're doing any college athletics. just continue to make good choices there and try to avoid all the COVID exposures that are in life in a college town as you're seeing all this unfold in the news as well. So thanks for tuning in. Have a great rest of your day and a great weekend.